FoodMed's plant-based meal prep is built specifically for metabolic health. Every meal is designed to stabilize blood sugar, reduce inflammation, and support the body's ability to heal. And it ships nationwide. Wherever you are in this country, you can eat food that is working for your health, not against it. Visit foodmed.com to order. If the kidneys, eyes, and nerves are the quiet victims of uncontrolled diabetes, the heart is where the stakes become loudest. People with diabetes carry a significantly elevated risk of cardiovascular disease, heart attack, stroke, heart failure, peripheral artery disease, and the reason is not one factor alone. It is the convergence of several: elevated blood sugar, elevated blood pressure, which frequently accompanies insulin resistance, elevated triglycerides, reduced HDL cholesterol, chronic systemic inflammation. Together, these factors create what we call the metabolic syndrome. And metabolic syndrome is one of the most powerful drivers of cardiovascular damage we know of. Here is the mechanism. Elevated blood sugar damages the inner lining of the arteries, the endothelium. That damaged lining becomes a site for plaque buildup. The plaque narrows the artery, restricts blood flow, and creates an inflammatory environment. Over time, that plaque becomes unstable. It can rupture. And a ruptured plaque in a coronary artery is a heart attack. In a cerebral artery, it is a stroke. Cardiovascular disease is the leading cause of death among people with type 2 diabetes. That is not a small statement. It is the clinical reality. And it is why when I treat a patient with diabetes, I am never managing blood sugar in isolation. I am managing a cardiovascular risk profile, the whole picture, the good news. And I always want to come back to the good news, is that cardiovascular risk is deeply modifiable through lifestyle. The same interventions we have talked about all series, the food, the movement, the sleep, the stress management, these reduce cardiovascular risk directly, not eventually, now. There is a growing, compelling, and increasingly clear body of research linking chronic hyperinsulinemia, obesity, and metabolic dysfunction to elevated cancer risks. Breast cancer, colorectal cancer, pancreatic cancer, endometrial cancer, liver cancer, kidney cancer. These connections are documented. They're not fringe science. Why does this relationship exist? Let me walk you through it. First, insulin is a growth factor. Its job, in the right amounts, is to signal cells to absorb glucose and to grow and divide. But when insulin is chronically elevated, as it is in insulin resistance and type 2 diabetes, that growth signal is chronically activated across the body. And cancer, at its most fundamental level, is the uncontrolled growth and division of cells. Second, chronic inflammation. The low-grade systemic inflammation that accompanies metabolic dysfunction creates a cellular environment where DNA damage is more likely and where the immune system's ability to detect and destroy abnormal cells is compromised. Inflammation is not just uncomfortable at the cellular level, it is dangerous. Third, visceral fat. The fat stored deep in the abdomen around the organs is metabolically active. It produces inflammatory cytokines. It produces excess estrogen at levels that can promote hormone-sensitive cancers like breast and endometrial cancer. It is not passive tissue. It is hormonally active tissue. I want to be precise here. I am not saying diabetes causes cancer. What I am saying clearly is that the metabolic environment that produces type 2 diabetes is an environment that elevates cancer risk. It does not require a drug. It does not require a procedure. It requires a lifestyle. The patients who do best are not the ones with the mildest disease at diagnosis. They are the ones who act the earliest, who take a borderline A1C seriously, who understand that diabetes is a whole body condition and respond accordingly. Managing diabetes and protecting yourself from its complications is not a solo journey. It requires consistent support, consistent monitoring, and consistent accountability between appointments, not just them. The My Best Health Pal app was built to be that daily partner. Track your health metrics, understand your numbers, access physician-guided coaching when you need someone in your corner. Visit mybesthealthpal.com and download the app today. Today's action step is about protection, and it is specific. If you have diabetes or prediabetes, I want you to confirm that you're getting the following screenings: annual kidney function labs, creatinine, EGFR, and a urine test for microalbumin. An annual dilated eye exam with an ophthalmologist or optometrist who knows your diabetes history. A foot exam at every physician visit, and attention to any tingling, burning, or numbness in your feet. And an active cardiovascular risk assessment, including blood pressure, cholesterol, and heart health. These are not optional screenings. They are the early warning system. They exist to catch complications before they become irreversible. If your physician is not ordering them, ask. Ask directly. You are your own best advocate. And if you want a physician who looks at the full picture, who connects all of these dots, I want to see you at Cooper Internal Medicine. Come in, let's look at everything together. Find me on social media, Dr. Dona Cooper-Dockery. Get Healthy with Dr. Cooper or Cooper Wellness Center.